You were in here last Thursday.
Who do you think I am?
You're Mr. Durden.
Just answer the question, Marla, please. Did we do it or not? Say my name.
Tyler Durden.
Why do people think that I'm you?
Why would anyone possibly confuse you with me?
Because we're the same person.
Did you?
What?
What the hell is going on here?
Well, Hank was coming on to me again.
Hank! Damn it. I'm so sick of that guy. Okay, Hank, come on out here. Let's settle this the old-fashioned way. Come on!
What you just saw were clips from popular movies that depict individuals with dissociative identity disorder. Some of these clips may have been familiar to you. This is because although you may not know the disorder by its name, you can recognize the symptoms. Dissociative identity disorder was formerly known as multiple personality disorder. The 5th edition of the Diagnostic and Statistical Manual describes the defining feature of dissociative identity disorder as being the disruption of identity characterized by 2 or more distinct personality states, which may be described in some cultures as an experience of possession. With dissociative identity disorder, the individual experiencing the disorder is typically referred to as the host, whereas the alternate personalities, known as the alters, are the personalities that develop over time and who typically play a particular role in the overall personality of the host. Some of the more common alters include child alters, sexual alters, abuser alters, and the protectors. Although there are 2 models currently used to explain the etiology of dissociative identity disorder, the trauma model is believed to be the more accurate model. The trauma model suggests that dissociative identity disorder is developed after severe trauma is experienced by an individual, specifically believed to be severe physical or sexual abuse during childhood. The personalities that develop as a result of the trauma are created as a coping mechanism for the individual. Symptoms of dissociative identity disorder can include depression, anxiety, delusions and hallucinations, confusion, flashbacks, amnesia, and disorientation. It is common for dissociative identity disorder to be comorbid with post-traumatic stress disorder and borderline personality disorder. Patients with dissociative identity disorder may have previously been diagnosed with having schizophrenia due to similar symptoms between the 2 disorders, such as delusions, hallucinations, depression, and confusion. The prevalence of dissociative identity disorder in clinical populations is estimated to be between 0.5% and 1%, although the prevalence in the general population is estimated to be much higher, possibly between 1 and 5%, with the female-to-male ratio being 9 to 1. As we previously mentioned, dissociative identity disorder is an extremely complex disorder related to the experience of trauma, typically occurring before the age of 5 or 6. The trauma can include severe physical, psychological, emotional, or sexual abuse. The alternate personalities develop over time as a coping mechanism for the individual. They typically exist to shield the individual from the painful memories. Oftentimes, the individual has no recollection of the trauma themselves. However, the alters maintain full awareness of the traumatic events. In a study published in the American Journal of Psychiatry, researchers collected objective documentation of child abuse and dissociation in 12 murderers who were also diagnosed with dissociative identity disorder. The study provided strong evidence in support of the correlation between childhood trauma and dissociative identity disorder. The researchers reviewed the clinical records for all 12 murderers and conducted interviews with friends, family, psychiatrists, and prison officials. The data collected proved severe childhood abuse had occurred in all 12 of the individuals. The interviews and records were crucial to the study due to the lack of memory each individual had regarding the trauma they had endured. All 12 individuals had little to no recollection of the personal trauma they had experienced. Even when the trauma was so severe, it was considered torture. Treatment for individuals with dissociative identity disorder can include psychotherapy and medications. The International Society for the Study of Dissociation published a specific framework for clinicians to follow when treating patients with dissociative identity disorder, which consisted of safety stabilization and symptom reduction, working directly and in depth with traumatic memories, and identity integration and rehabilitation. The beneficial use of medications in treating dissociative identity disorder is still being researched. However, psychiatrists have used anxiolytics and antidepressants in their treatment approaches. The best treatment option for dissociative identity disorder is believed to be an integrated treatment approach, in which medications are utilized to minimize anxiety and trauma-related symptoms, while psychotherapy is utilized to focus on the individual and his or her alternate personalities. Dissociative identity disorder is a complex disorder that occurs when an individual has endured such severe trauma that alternate personalities are created in order to protect the individual from the traumatic memories. Treatment for this disorder is also complex, but with long-term psychotherapy and medications, it can be successful.